Wonderful to have the third generation of you coming over here to Powai at Hiranandani Gardens and to our hospital here today. We are extremely proud of what Maharashtra has done in this pandemic. We had a very conservative view, a view that nobody else ascribed to at the initial stages. And we found that the Honorable Minister, the Chief Minister, was even criticized for the kind of action that he was taking. The conservative proved to be right. His administrative experience was almost considered to be zero. But his handling of the pandemic was considered to be so superior that even the Supreme Court of India, international journals and other magazines and papers have ascribed it as one of the best. The kind of chasing to get the vaccine, to get the virus of something which happened in Dharavi is something we will be always proud of something which has never, ever happened before. During this pandemic times, the hospital led by Dr. Sujit Chatterjee, Dr. Manish Gupta, wonderful doctors and nurses and others people have done yeoman's work in order to take care of it. We have handled 9,500 COVID patients, 5,000 bad cases which have been admitted to the college. We have also admitted 17 nurses and 6 doctors who have had to be with COVID and did all these things. We have also vaccinated 15,000 people within the hospital, and we continue to do so now that we have been able to obtain some of the vaccines. On an iconic thing, we have had now the new generation of medicines. The monoclonal antibodies, the 3rd-generation drug, is what we are already administering. We have also obtained during this period the ECMO machine, which has taken care of the heart-lung position and problems of severe cases, an exceptional item which we decided that we will do it. And this would be useful to us when we do heart transplant at the next level of operation. All these things we have continued to do at this point of time, which is there. I wanted to congratulate Darshan for the idea of the oxygen plant that he initiated and discussed with us at that point of time, but especially in order to be able to give us the confidence of being able to do it in the shortest period of time and pushed it independently. Thank you very much, Darshan, for doing so. But after all, today, we are extremely proud and we consider it a very, very important moment for this hospital that you are here today to inaugurate this plant. This plant is but just one more step of this hospital to take everything in terms of medical treatment to the next level. We don't want to leave a single point at risk for our people, for our community, for our city, and for our country. And hence, I'm extremely happy over here today that this inauguration is taking place. And we have the youngest minister who has come over here to inaugurate this plant, because we do need new ideas, new thoughts, and taking the new generation to the next level. So thank you very much for coming here today. My repeated congratulations to, and you must communicate to the Honorable Chief Minister for the great success that he has made in handling this pandemic exceptionally well. Though even at some point of time, even I had a doubt whether this is really going to work in a proper way. But the real thing was that he proved to be eminently right in every action that was taken up in the pandemic, and it is now recognizedly so. I want you to also wish each and every doctor, each and every nurse, each and every intensive care person, I promise you, sir, that they have done a yeoman task beyond the call of duty. They have suffered with their families and things, but they have really stood out tremendously. And we have certificates from all the patients who have told us and written to us and told us continuously of the empathy that they have received, not just treatment that they have received. And that, I think, is a very important part and parcel of what the hospital desires to do in this city and in this country. So thank you very much for coming here today. to inaugurate this plant and wish all of us a great success in the future to continue in the service of the people. Thank you. I must also mention, without a doubt, that in this pandemic year, the Honorable Chief Minister too has inaugurated two of our major operation and new initiatives which the Hiranandani group took up, which is the largest data center in Asia in Navi Mumbai, which set up a mark apart from the rest of the country in terms of data localization, and the starting of the HSNC University, which is also taking education to the next level. And I assure you that all the 45,000 students of the HSNC board have benefited from the online working that has been done, and we continue to take care of various aspects of this. Thank you very much for coming here and agreeing to speak to us and inaugurate this plant. May I now request Aditya ji to please address us and then inaugurate the plant.
Thank you, Niranjan sir, for inviting me for this momentous occasion in the history of not just a city, but for the country. To all those present here, I see Darshan ji, I see, of course, Niranjan ji, I see Dr. Chatterjee, I see Dr. Gupta. Let me tell you that I'm going to keep this very, very short, because I know there are lots of people standing near the PSAs that I can see on the screen. I don't want them to stand for a long time. And I say this because normally in any VC or any inaugurations like this, we have the luxury of going a little further and obviously speaking more. But whenever I have interacted with Niranjan ji or Darshan ji, our time span of interaction, be it meeting or be it on the phone, has roughly been equal to, if the minutes of the meeting, if you see, they're roughly equal to the number of letters in Hiranandani and Thackeray put together. That's how much we speak, and we can go on about different topics, and we can go on and on and on about this. I was just speaking to Darshan ji the other day, and I was telling him one of the things I'm missing in terms of interacting with Niranjan ji normally is, I think this year, after he got COVID and then I got COVID, we have not met each other. And that's been quite a long time. I think it's about 5 or 6 months. But before that, throughout the last year and before that, I remember my first meeting when I took over as a minister, and then on, we've met almost every month, at least once or twice every month. It's always been such a pleasure to meet him, because there's not just an interaction, but there's also a sense of learning that I get in my meetings with him, because he is one person, like he was remembering right now, who was interacted with my grandfather, who has interacted with my father, and of course has been interacting with me. Knowing him as a family friend, apart from that, his interactions with my grandfather have, ranged widely from something like a nursery and trees to the Mumbai-Pune Express Highway, which he has told me very many stories about, right from the planning to what base it must be, should it be asphalt, should it be concrete, to where it should start off and where it should land, to the 55 flyovers that we see in the city of Mumbai. So I see him as a mark of, whether what I am thinking is on the right track in terms of infrastructure, in terms of education, in terms of environment, and how probably my grandfather would have seen because of his interactions with him. So I think that is something I really cherish, and I hope to see him very, very soon in safer times, of course. And now that both of us have antibodies, and if the doctors can clear us to meet, I think that should happen very soon. But Niranjan ji, like I have my interactions with you, since you introduced me to Darshan ji, I think late last year, we've had very many interactions like this, and the whole idea of PSAs came about in my interaction with him, because I think it was about early March in a conversation that he told me, saying, Aditya, there is something I would like you to read upon and try to investigate further. There is a thing called PSAs that we're getting into our own hospital, and let's see if we can do this across Mumbai. I had a conversation with him. I think we had that. And again, we have a conversation around late evening, so that we can go on and drift into the night, that we can go on to about 45 minutes to an hour on the phone. And when you, Darshan ji, spoke about PSAs to me, I remember this conversation very clearly, that we started researching, we started looking at many companies, and you also hinted at the vendors. We went to the depths of vendors. And within that week, Dr. Chatterjee, I read about a news article, because we had discussed about this in the cabinet. I mentioned Darshan ji in the cabinet. I said, look, he's a friend and he's told me about this. He's doing this at his own hospital. Why don't we start looking at this? The same week, there was an article in the newspaper which said that the government of India is actually looking for PSAs now and has started, funding PSAs. So I called him up immediately. I sent him a screenshot of this. I said, "Do you know the source of this? Because I think it might be you." And he said, "Yes, I've had a conversation with the government of India, and this is the seed that I've put in their minds." I think this is something which is really, really important because both, if I may call him now Chancellor Hiranandani from last year onwards, and Niranjanji and of course Darshanji, both of them, the whole fact of the matter is both of them are always thinking 5 steps ahead of their time. I think that is something which is really, really needed when we govern a city like Mumbai or a state like Maharashtra or as diverse as India. We need ideators, we need echo chambers like the both of them, where newer ideas keep coming. You have a frank opinion exchange and you have things that work or don't. Of course, when Hiranandani ji was, praising the chief minister and my father, Mr. Uddhav Thackeray, for having a calibrated lockdown or being successful at trying to control the cases in our state, and we've not hidden a single case. So it's of course, a task for the administrator or the chief minister who's leading the state to take it ahead. But it's not possible, honestly, without people like you and all the doctors, all the nurses, all the echo chambers that we have, because I think it's frankly a teamwork. We both of us believe that it's teamwork. Without the fantastic job of our local bodies, of our administrators, of our doctors who've gone above and beyond the call of duty, of our nurses, of our medicos, of our hospitals, of our COVID care centers, of our primary nursing homes, this wasn't possible. Today, this landmark occasion that we are having in our city, right after this, in the coming week, we're having 8 more PSAs. And Darshanji, that is because you put me onto the job. I've got CSR supporting 8 more PSAs onto our municipal hospitals. But like you rightly said, this is something where we are calling Maji Zawabdari. This is my responsibility. This is my family. This is my city, my state, my country. If all of us start looking after our own self, starting from wearing a mask properly, starting from using a sanitizer properly, starting from isolating ourselves properly or following all the COVID appropriate behavior, that is where we really can start off in a normal society again. Because last year, when we were in our first lockdown, of course, we thought, okay, after COVID, I'm going to do this. After COVID, I'm going to go here. Let's meet after COVID. That after COVID has not yet come. Most of us have got COVID. We have come out of it successfully and thankfully. Many of us couldn't go through it. Many of us took it too heavily. But what is after COVID for us? I think after COVID for the human race is such innovative ideas that are going to not take us to the hospital, not take us to COVID, but if at all we do go to a hospital or a nursing home or to COVID, how do we cater for them? How do we empathize with them? How do we serve them in a way that does not put the strain on our doctors first? Because our doctors have been serving throughout since March last year to almost this year, and probably I don't know how many more years in this COVID times. It's a never-ending thing for them. For us as politicians, for us as leaders, for us as administrators, for us as business people, we've had fluctuations when things have started and stopped again, when things have moved from one place to another. But for most doctors, they haven't come out of COVID wards, because even at our lowest, we were at 150 cases a day. At our highest, around April 4th, we were at 11,000 cases in the city of Mumbai and probably 60,000 more in Maharashtra. I think this is where we need to start thinking for ourselves. If we start thinking for ourselves, we're thinking for a society. If you're thinking for a society, we're looking at the doctors, the BMC people, the policemen, the frontline workers, the healthcare workers, and such initiatives are the ones that are going to help us sail through in such testing times. In testing times, of course, again, I'm not praising you, sir, because you are on the screen, but I've said this very often, that we've also looked at various aspects of the industry. And if I may remind you, the one meeting we had with the chief minister in terms of getting the real estate industry back on to its feet. I remember the articles you've written through Assocham, through Credai, through all of these. I think what we have managed today in Maharashtra is a calibrated lockdown. And again, it's largely possible because there is a synchronization and an echo chamber for the chief minister in people like you who have given ideas to support the economy, to support education, to support the industry, get things back on the ground, keep the essentials going when we have a lockdown on the people and on non-essential services. Darshanji, I would want to congratulate you, but before congratulating you, I think I would want to wish you all the best, because congratulating also means that you have successfully completed something. And I don't want us to stop here. I want us to go further, because this is just the beginning of one of the few innovative ideas and one of the many more ideas that we're looking at, be it HGAS, be it education, be it such PSAs. I think this is only a beginning. PSAs is something we're looking at across Maharashtra. We've floated a tender for almost all hospitals. We're looking at private hospitals playing a major part that they have supported us with all throughout, because here is a moment in time where we cannot differentiate between private and public. Where there is a lack of oxygen, the virus isn't asking whether you are private or public. They aren't asking us whether you are a normal citizen or a government agency or a private agency. I think this is the time for all of us to not just come together as one human race, not as Homo sapiens, but as planet Earth, because all of us are learning to coexist better. I can see the image on my screen. The PSAs are not isolated from the trees behind it. They're a part of it. The PSAs are doing the job for the patients inside the hospital. The trees are doing the job for the people outside the hospital. I think this is a time for us as planet Earth to come together and realize that all of us are really a part of this one planet called nature. A planet called Earth, a part of this whole system called nature. We cannot be different from each other. We are all together, and let's work for each other. Let's work for coexistence and move further. Thank you. Jai Hind, Jai Maharashtra, Vande Mataram.
Please inaugurate the conference. You have to announce to inaugurate the conference.
It's an honor for all of us to be inaugurating this together.
Thank you.
I here announce the plant is commissioned and is in service right from now. You can see the panel. Apply now. Will be the further ceremony.